Hello, good afternoon, good evening. Today, I'm a little bit disappointed that I forgot to bring a model home again today, because we're going to talk to you today about bunions. And bunions are significantly easier to see if I had a foot model where I could actually say. So I'm going to describe this to you tomorrow when we talk about Taylor's bunions. Hopefully I can get my hands on a model and we can actually show you both a bunion and a Taylor's bunion at that time. But a bunion is commonly thought of as just a bump. Well, the truth is, what's happening is you've got the big toe and the foot. So if you got the foot here, you got the big toe. What happens with the bunion is the big toe starts to turn in and the metatarsal turns out, and so you get a bump on the outside of the foot that looks like a big bump, but it's actually bone. So instead of being straight in alignment like this, the metatarsal turns out, which causes the toe to turn in, so you get the bump on the outside. They can be quite painful. They can be caused by certain types of activities. We see it more often, for example, in dancers, like ballerinas. Although, the interesting thing with that is, this is a genetic problem. If you have no family members that have bunions, it's unlikely, even if you wear bad shoes, even if you do things the wrong way, it's less likely that you will have a bunion. And there's individuals who can do everything right and still have a bunion, still have bunion pain, and so forth. Things that make a bunion worse is tight shoes, activities that are putting pressure in that area. They're more common, for example, in women because of the symptoms of a tight shoe or so forth. So we actually see them very, very commonly in women, in dancers, and a lot of times they need to be treated. Age range, you can have kids with bunions, although in most cases, the bunions that need to be treated are usually in adults, usually older individuals. A little bit more common, like we said, in women, but we're seeing them in men and women. How are they diagnosed? Truthfully, the most important thing is x-ray. So you can have a bunion that looks really, really bad, and you do an x-ray and say, okay, it's not that bad, and so it's not as big a problem. And so we look at x-rays, we look at the appearance of the foot. If there's a bump on the inside of the foot right behind the big toe, that's your bunion. The other things that we will typically do is we check for motion, because you can actually not just have a bunion on the side, but you can also have a bunion on the top, which is called really a hallux limitus, because it will limit the motion of the toe, but you start creating a bump on the top of the foot in that way. And it can be just as painful, sometimes more painful than a normal type bunion. So what are the options for treatment? So if you say, okay, I have a bunion, it was diagnosed, we did do an x-ray, we confirmed that that really is what's going on. What are the options for treatment? There are things you can do for symptoms. Typically, I don't do those because they don't fix anything. You can treat the inflammation. You can give an injection to the joint to decrease the swelling and give you 4 to 6 weeks of relief. Typically, I don't recommend that because it doesn't fix the problem. You can use spacers between the toes that help straighten the toe out. That'll take the pressure off. It reduces the symptoms, but doesn't fix the problem. You could also use inserts or custom orthotics. The big advantage of custom orthotics or inserts with a bunion is it limits the progression. It keeps it from getting worse. Again, it doesn't fix the problem. Any of those things can be utilized short term, especially if you're saying, okay, I'm not having a lot of symptoms, but I don't want it to get worse. All of those are a good option. The one I usually don't do is a cortisone shot, because why would I cause pain to give you a short-term relief of pain without fixing any problems? So a lot of times I don't do that unless someone's got an activity or something they need to do, and you're saying, okay, we're giving you a short-term relief. And most of the time with the bunion, if it doesn't hurt, I recommend you don't treat it. You don't have to treat it because it looks bad. You don't have to treat it because it doesn't fit in shoes. I recommend you do the treatment when it interferes with normal activities, with things that you would normally do, especially if it's starting to limit what you can do with your life. So, and the treatments are really, there's really only one treatment that fixes the problem, that's surgery. And there are multiple different surgeries that can be done for a bunion. There are surgeries that can be done at the head of the metatarsal. There are some that could be done in the middle of it and at the base of it. And there's even fusions and other things like that that can be done for this. Truthfully, to go into great depth, you need to see how bad your bunion is and get a determination of what types of surgery can be done. The most common surgery that we do for a mild bunion, or a bunion that's interfering, that's only really affecting the head of the first metatarsal, is called an Austin bunionectomy, where we do a cut through the bone, a V cut through the bone, move the bone over, stick a screw in there. Advantage of the way we do this is you can walk on it pretty much right on the bat after you give yourself about 48 hours of limiting what you're doing. And we get you back in normal shoes anywhere from 4 to 6 weeks, depending on how it is healing. So we can get you back pretty quickly. And some of the stuff that we'll do is we kind of get you moving that toe as quick as possible to limit stiffness of the toe after a bunion surgery. So this is Dr. Brandt Gibson, and we talked to you about bunions. Like I said, I will try to show you in the next couple days on a foot model really what a bunion looks like. But the truth is, if you have a bunion, if you have a inflammation in that area, if you have pretty good pain, there are things that we can do to alleviate the pain short term, to reduce the progression of the pain, or if we need to, there's surgery that can be done to fix the problem and get you back to normal so you can have your normal life. This is Dr. Brandt Gibson. This is your Podiatry Tips, day number 18, and we will talk to you tomorrow.